Hi, welcome to the channel, and today we are going to discuss a very interesting case in which he had subconjunctival air after trabeculectomy underneath the bleb. So if you just have a quick look at the patient over here, so you can see this air in the subconjunctival area, and this is the bleb which is forming anteriorly, and the bleb is a diffuse bleb and does not seem to be an avascular bleb at this time. If you go forward on this one and look at this on the slit lamp, we'll actually see the video showing us the different parts of the bleb, and this is the diffuse bleb. So I just use three sutures, one medial, one lateral, and one central suture, and you can see the releasable suture which is lying over here. You will see the knot or the loose suture over here, and then what you see is the patient is pseudophakic and he has got a deep anterior chamber, and you can see the depth of the anterior chamber by just looking at the distance between the anterior slit and the slit on the iris. That tells you that the air the patient is going to be CDL negative and it's going to be a good form bleb. And you just go in and just gently lift the lid up and just look at the bleb over there. And now I'm going to see what the fundus looks like, and the cup disc ratio is pretty big, and it's 0.9 with the pallor of disc which you see in this patient. And here I'm going to show you, this is the normal anterior chamber of an eye, and if you put air in the anterior chamber, what that is going to do is that is going to prevent that adhesion or between the cornea and the iris postoperatively. And the other thing is peroperatively is going to make you that formation of chamber, and the other thing is going to make you let suturing of the structures of the trabecular bleb very easily at that time. So this is what it looks like, and if we go forward, I'll just show you injection of air into the anterior chamber. You can see this is a 30 gauge needle, and I'm going to inject it right at the junction between the limbus and the cornea. That is very important. If you go very anteriorly into the chamber in a soft eye, you will tend to go intrastromally, and sometimes when you inject that air into the intrastromal space, the cornea becomes all white, making all things difficult for you. So this is the air, this just going at the scleral area, so that is this area which is slightly rigid, and you can see you can have one or multiple bubbles over there that forms the anterior chamber. As soon as the anterior chamber forms, the suturing of the scleral tissue becomes much easier in these patients. Take home message is air is useful to maintain the anterior chamber. It helps you to finish your surgery appropriately, suture your scleral wound easily, and then post-operatively, if it goes beneath the conjunctival bleb, it was going to prevent the formation of adhesions between the conjunctiva and the sclera. The only disadvantage is in patients who are phakic, it can cause formation of a cataract. If the patient is pseudophakic, it is very useful and it makes life very easy during surgery. Thank you very much for watching, and hope you like this video.